Hello, I'm Dr. David Mabry, and this is one of my patients, Crystal, and we're making a video about what to expect during a typical filler and Botox treatment. Crystal and I did some treatments about a month ago. We're going to see that actual footage, and then we're going to follow up with some questions for Crystal about her actual experience.
At the beginning of every treatment session, I will photograph a patient in different views, and together we'll review those photographs on the computer. We'll make a plan together, and then we'll start the injection. I like to draw out where we're going to inject, so let me see here. Okay, so now we're going to inject a little Botox, and you've had Botox before? Okay, and so we're going to take a look in the mirror. And we're going to do some Botox for the wrinkles across your forehead, frown for me, and for the wrinkles between your eyebrows. So the movement here is what causes these wrinkles, and when we put Botox in, we're able to relax the muscles and give her a nice smooth forehead. So we'll do some of that today. Okay, are you ready, Crystal? Mm-hmm. Okay, good. So raise your eyebrows and relax. Good. Turn towards me. And good. Raise your eyebrows. Relax. Okay, if we were just treating your forehead, that would be it. Pretty straightforward. And now we're going to treat your eyebrows. Frown for me. Okay, good. 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 How does that feel?
Definitely hurts more than the other.
Yeah, right. So that you can
but it's not bad.
But you can throw the Botox more than the fillers.
Yeah.
Okay, and we'll watch with a new needle, so frown for me. Okay, good, relax. And how does... Good. What's it feel like?
It's a long sting.
Yeah, it's kind of annoying, I think.
Yeah, it's annoying.
Yeah, when people ask me what it feels like, I tell them it's kind of annoying. Okay, good. That's it for the Botox. So the Botox you'll start to notice after about 3 to 4 days, and I'll see you back here in 2 weeks. And when you come back, your eyebrows will be slightly higher, they'll be smoother here, and your forehead lines will be gone. Good. Okay, and here we can see Crystal's before and after images. Her forehead is smoother after Botox. The horizontal lines are less. Her brow looks nice and natural. Under her eyes looks smooth. In general, we can see that Crystal looks more refreshed and she looks more polished. Hello, I'm Dr. David Mabry, a facial plastic surgeon in San Francisco, and today we're going to illustrate some treatments of the face with Restylane, Juvederm, and curling. So here we have a little bit of an indentation here, and we have some indentations here, and so today we're going to take some fillers and fill in this area, but importantly we're also going to work out in the cheek area here, and that's going to be really important for making her look younger, but also making her look better. You're really going to like that, Crystal. I like to draw out where we're going to inject, so let me see here. Have some ice here. Okay, you can ice the other side now. Here you go. So I was just going to mention, so here where we're treating, one of the things I want to do is avoid some of the veins that we have here. Close your eyes. And we'll just watch that, and we really are sort of sculpting from the inside. And 1, 2, 3. Good. Make it feel that a little bit.
Mm-hmm.
So we can look at one side versus the other. Take a look in the mirror. And you can see how this side is nice and full and smooth, just like you'd want to have your makeup. You look good. And then on this side there's a little bit of shadowing and a little bit of lowness to your cheek there. So we're going to make this side look like that side now.
Awesome.
Okay? And take that one. One of the things we're trying to do is make a smooth transition from your eyes to the lower part of your face. And sometimes we can see a line like right around the bone of your eye socket. We want to smooth that out. Take a look in the mirror. So what we've done so far, now the cheeks are up, right? That's giving your cheek. And what will be really nice when you look at yourself on 3/4 view, this cheek will be out. You see a shadow, we're going to fill that in. So that'll be nice and smooth. And we're going to come across there.
Good.
Okay, cool. All right, turn and close your eyes. 1, 2, 3. Can you feel that?
No.
I actually tell patients if they've had Botox, it actually is slightly less painful because you don't have, you feel every Botox injection you do. And you and I were talking about that. So if you do Botox, it's pop, 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 pop. You feel all of those. But with the fillers, there's one injection, it's under the skin, and then I do a lot of work, and you don't feel that. And then as I'm doing the work, it gets numb, so it hurts less. And how do you feel?
Good.
Good. Okay. Hold some pressure there for me. Awesome. Well, I really like the way it's looking. I think it's going to be great. So I'll see you back in 2 weeks. You can go back to work now. You can. I would, if you're going to exercise, I would say light exercise over there. And if you want exercise, you can. But strenuous activities may increase the risk of bruising. So with that, if you don't care, I've had some injections myself, and I found myself in the gym, and I can feel swelling.
Right.
But that's neither here nor there. And thank you very much.
Thank you.
Okay, and here we can see Crystal's before and after images. Her forehead is smoother after Botox. The horizontal lines are less. Under her eyes, the shadows have been removed, and her cheeks are now augmented. This gives her a more youthful, more attractive face. On the frontal view, we can see the same things. Her brow looks nice and natural. Under her eyes looks smooth. In general, we can see that Crystal looks more refreshed and she looks more polished.
Hello, I'm Dr. Mabry. In this video, I'd like to discuss non-surgical options for revision rhinoplasty using fillers. The goal for most rhinoplasties is to make the nose more attractive, and this is achieved by creating a smooth contour of the nasal bridge, ending in a defined and proportionate nasal tip. This can be accomplished non-surgically using fillers, a gel-like substance that are placed under the skin with a needle, and they're used to shape and contour the nose. And they can be used to shape and contour the nasal tip, making it smaller and more defined. Non-surgically, you can augment the nasal bridge using fillers to make it longer, more narrow, and more defined. In revision rhinoplasties, we have a different set of challenges. There are some patients who simply don't want more surgery. There are some patients who need a great deal of structure and contour. And then there are some who've had a pretty good surgical result but need a small change. And this can be just as challenging surgically as the big changes. And finally, I'm going to show that there are some patients who've had a surgical rhinoplasty that have some roundness, and it appears that they need to have their tip reduced in size, but they actually could use more support, structure, and contour.
So our first case is a patient who was pretty unhappy with their first rhinoplasty and really didn't want any more surgery. She had this dip above her nasal tip seen on profile, and we were able to treat her in our office by placing some fillers there. And we did that avoiding a trip to the operating room, and everybody was happy. This case is a little more challenging. She had a great loss of support, a lot of irregularity of her nasal bridge, and the tip was neither proportionate nor defined. So we were able to build this up, give a great contour of the nasal bridge, and you'll see that the tip actually looks smaller and more defined than it did previously. This would have been very challenging to do surgically and would have required another trip to the operating room and several months of recovery. And this is a patient that I operated on, and we were both really happy with the profile view. We augmented her bridge and made the tip more proportionate and defined. On frontal view, we were happy with the nasal tip, which was smaller and more defined than before surgery, but now that the tip was smaller, she started to notice a bump on the left side of her nose. We looked closely and we saw that yes, this bump had been there before the surgery, but now that her tip was smaller, the bump was more obvious. And in fact, the bump was really caused by this slight concavity that she had on her nasal bridge. And so we treated this by adding some filler to that concavity. And in this way, we were able to, again, create a bridge with a smooth contour that ended in a defined and proportionate nasal tip. And we were able to change a good rhinoplasty result into a great result. And this final case I want to show is a woman who also had multiple rhinoplasties and left her with an irregular contour of her nasal bridge and a round and undefined nasal tip. Now, I did treat her surgically for the nasal bridge, but for the tip we actually used fillers to add some definition and make it more proportionate with the nasal bridge. And how long do these fillers last? They last for a total of a year, but at 6-month intervals is when most patients come for a touch-up. So this is a man who before had a downward slope and curve of his nose. We used the fillers to change that curve and make it slightly upturned. And this is him 6 months later, where he has lost some of the fillers, you can see that, but he still is better than when he started. So when he comes back at 6 months, we use some of the filler to maintain his results, and we take the extra filler and we place that wherever he wants, under his eyes and his cheeks, lips, etc. So in summary, non-surgical techniques are an excellent choice for revision rhinoplasty. We use fillers to contour the shape of the nose. The procedures are done in about 15 minutes in the office, and patients return at 6-month intervals. Hello, I'm Dr. David Mabry, a facial plastic surgeon in San Francisco, and today we're going to illustrate some treatments of the face with Restylane, Juvederm, and Perlane. So the upper lip is just a little small, and this is a really important area for a youthful look. Actually, Crystal's lips look nice. They look still youthful, but there's a size differentiation. So we're going to augment this a little bit, and maybe a little bit in the lower lip to make that nice and full. For the lips, I like Juvederm. I find that out of the hyaluronic acids, it's the smoothest in the lips. You can use Restylane, Perlane. Occasionally you'll feel a little bump or nodule that you have to massage out. With the Juvederm, you almost never feel that, and it tends to last a little longer in the lips also. Now, one thing I want to show you that we'll do, I'm going to be very careful not to give you duck lips. So we don't want to just do the borders here. We want to do the body.
Where does the filler go? Is it on the top or
Well, that's a good
behind?
question. The needle is going to go kind of in the middle of this and going. So as I go along, the first one you feel with the pinch, it's probably going to be a 6 out of 10 thing, but then it gets numb, and then as I go along here, you'll feel these are going to be the most tender. So, and then it'll be numb. Relax for me. Okay, open your mouth for me a little bit. All right, 1, 2, 3. Good. With your face in general. Good. Okay, 1, 2, 3. So we go slowly, and I'll be watching for symmetry. Great. Take a look in the mirror so we can see one side versus the other. You know, it's a little fuller, a little powderier. And we may do a little more, but we'll go slow and you can tell me. All right? All right. 1, 2, 3. Open your mouth for me. About half the time, the bruising can be concealed just with lipstick. And the other half the time, someone may notice a bruise, not necessarily in their lips, but like kind of around their lips a little bit. And that can last about a week. On this side, there's a little bit of more of a gap. This part comes up more. So I'm going to try to close that a little bit. All right. Open your mouth for me. Thanks, Crystal. That's it. Okay, go to the mirror. And I'll see you back in 2 weeks for your before and afters. Okay, thank you. Okay, and here we can see Crystal's before and after images. And her lips are fuller. The top lip is in better proportion with the lower lip. And on the profile view, we can see the nasal profile improvement and the improvement in the lips. Hello, I'm Dr. David Mabry, a facial plastic surgeon in San Francisco, and today we're going to illustrate some treatments of the face with Restylane, Juvederm, and Perlane. And Crystal had mentioned her nose. We're going to treat that today non-surgically, and what I like to do is there should be a nice smooth line that comes from the eyebrow to the tip. And when I look here, there's some indentations here, and there's an indentation here, so this line is a little irregular and broken, so today we're going to treat that non-surgically and put some fillers in there and improve the appearance of her nose. Okay?
I had one other question though.
Oh, great.
The sunglasses, since it is a filler,
yes.
How does it mold? How does it solidify so it doesn't cause indentation?
Yeah, that is a great question. So if we're doing a non-surgical rhinoplasty, that's a lot of people say, well, may I wear glasses? Is it going to move the filler around? And when does the filler get hardened or stiffened in place? So when we put the fillers in, and I have another video of this, they're a soft jelly-like material, a lot like your skin. And they'll act like your skin, so they don't ever harden. They'll stay soft at all times. So if you were to take your finger and press down like this without fillers, and you hold it for 10 minutes, you might see that. Or if you wore glasses, you might see that. But afterwards you can fluff it back up. The fillers are going to be just like your own skin, so you can still wear glasses, and you won't have a permanent mark that you get from that. And the first thing I like to do, put your head back from me. I like to draw and see what I like is, I call your dorsal aesthetic lines. And then I'll look and see where you're missing something. So I really see a lot of indentation between here and here. So we're going to work on that. Are you ready? Yeah, you'll feel that a little bit. Is getting rid of concavities and contouring. That looks good. Okay. Yeah. It's like it's getting there. So you don't have as much bruising with the nose as you do with the eyes, but every now and then you can get some bruising, so I tell people to be prepared for that. Okay. Let's say you have an area that's has indentation, and it's like this, and the skin is down there. So when I put the fillers in, I kind of fill that in so that the surface is flat. And what I find is that even when the fillers go away, the skin goes down like this, flatter. So even when the fillers are gone, it probably won't be as indented. So in your case, where the bone transitioned to the cartilage, there were some areas where the skin was stuck down. So I've kind of filled that to just make your nose smoother, like you would powder your nose just to make it smoother. That's what we've done with the fillers, and you'll find that even when they're gone, it'll be smoother than it was. Okay, so nose is done. That looks pretty good. Okay, and here we can see Crystal's before and after images. After the non-surgical rhinoplasty, the contour of her nose is smoother, and on the profile view we can see the nasal profile improvement and the improvement in the lips.
Hello, my name's Adrian Richards. I'm a consultant plastic surgeon based here in the United Kingdom, and I'm also the surgical director of Aurora Clinics. Today I'm going to be talking you through an operation I recently performed on a lady, which was a traditional type facelift with an incision behind the ear. Here you can see me just marking the where I'm going to place my incisions in front of the ear and now behind the ear. This is just in the fold behind the ear, and now I'm extending this down onto the junction of the hair and the normal skin in the neck. So I'm making my incisions now, and this one's going to be hidden within the scalp hair, so it'll be very difficult to see, as I'll show you later. And my next stage is just to make an incision in front of the ear here, following the natural curves of the ear, so the skull will be well concealed. I'll then go behind the ear. This is my sulcus incision in the fold behind the ear, and then I extend down onto the hair bearing skin here, nice and gently, cutting through the skin. So I'll elevate the skin off the deeper tissue, which I'm doing that here by sharp dissection with the scalpel, and here you can see a vein which I've preserved. Same sort of technique in the cheek area, just gently freeing up the skin from the underlying SMAS tissue. That's the SMAS tissue, which you may have heard about there. So here I am just creating some tunnels slightly more anteriorly, just to complete my dissection anteriorly. The next stage is to free up the skin from the back of the ear here, and you can see now I've got a good dissection really right down into the neck where I can see the muscle, and here I'm just showing the SMAS layer. I'd like to tighten this whole area up with permanent stitches, and here you can see I'm tightening the platysma muscle in the neck, and I secure that back here to the firm fascia here, so I've got good secure fixation of this tissue, which will give me a long-term improvement in the soft tissue of the face. Here I am just putting my stitches in to control the jowl. This is the jowl control stitch, which again I will secure to solid fascia just above the ear in the temple area. So this deep fixation allows me to remove the skin. I'm just showing you here the skin I'm going to remove. So I tend to remove in the temple 3 to 4 centimeters of skin in a vertical direction, and behind the ear again 3 to 4 centimeters behind the ear in this region, and this will give me good elevation of the neck tissue. And this is, you see me just lifting up here, this is the skin I'm going to remove in this region. The next stage is to remove the skin, and you can see I'm doing that here with my very sharp special scissors, and this incision will hug the contours of the ear. This is the skin I've removed behind the ear, and it's been closed with absorbable stitches. Here I am just showing the skin I've removed. This is just before my final closure. I put some deep stitches in here, and this is the appearance 10 days following the operation, when the stitches have been removed, and as you can see the incision hugs nicely the contour of the ear and is difficult to see. Thank you for watching this video. If you'd like any information on this procedure, or indeed any other cosmetic procedure, please contact us either via the website or by phoning us on a UK number 01844 214 362. Thank you very much. Hello, my name's Adrian Richards. I'm the Surgical Director of Aurora Clinics. My background is I'm a plastic surgeon and tend to specialise in cosmetic surgery nowadays. Now, I've talked in other videos about facelifts, and there's an awful lot of difficulty. I talk to a lot of people and they find it very difficult to tell the difference between short scar, long scar, traditional facelifts, neck lifts, smash lifts, S lifts, deep plane facelifts, and very, very complicated. Okay, but basically it's not that complicated, it's just a lot of long words used to describe these techniques. So what I'm going to talk about today is a neck lift. Okay, so normally when people talk about a facelift, there is some elevation of the neck, and it should really be called a face and neck lift. Okay, so if you lift the neck, you will, because you don't want to leave a pleat here, you have to lift the face to a certain amount. So maybe a better term is a lower facelift, okay, which includes the neck. Okay, what problems do you get with the neck? Well, as you get older with gravity, the tissues of the neck tend to loosen, you develop jowls along the jawline and loosening in the skin, particularly in the central part of the neck, and you tend to lose your definition between this is the mento-cervical angle. So the mental is the chin, cervical is the neck, and this angle should be nice and tight, but with time, as the skin loosens, it loses its angle. And you can also get what we call prominences of the platysma. So platysma is the muscle of the neck, and when you contract that, I don't know if you can see, you get bands in the neck like that. I've got one on that side, and that's basically the muscle of the neck contracting. Okay, so if you're concerned about the neck, you need to consider the only real way of tightening it up is by some form of surgery, which is normally performed by an operation principally designed to tighten up the skin of the neck. Now I'm going to talk about that operation in another video, but essentially most techniques involve an incision in front of the ear and then extend it in the fold behind the ear and then back in the hairline. Okay, that allows us access to the neck where we can tighten up the muscles and tighten up the skin. And normally, sort of 2 to 3 centimeters of skin is removed in that area to tighten up the skin of the neck. In some cases, some surgeons would also do what's called a submental incision, which is an incision in the fold underneath here, underneath the chin. So you've got a natural fold there, an incision is made in there, and that allows us to access the muscles. That's the platysmal muscle, I've got a particularly bad one here, so the surgeon will visualise that, we can remove bits of it, or we can sew the muscles together. So by a dual access from the sides, little incision here, we can see the whole neck, tighten up the muscles, tighten up the skin, and that gives us much better control of the neck rather than just a lateral incision. Okay, so really with facials, any form of facial surgery, the best technique really needs to be tailored to the individual. Okay, so younger patient without neck laxity, mid-face descent, often a max facelift is suitable. With neck problems, really depends on what the issue is. If we have got platysmal bands, if we have got a lot of loose skin in the central area, we need to consider a lateral lift and possibly a submental incision, which is normally very well hidden, to give us direct access to the muscle so we can deal with that. So I hope that's clarified some of the issues. I'll be talking in other videos about other techniques, mass facelifts, deep plane facelifts, to try and clarify those for you. If you have any questions or queries from the video, please contact us either by ringing us on 01844 214 362 or by emailing us at the Aurora-Clinics website. Thanks for watching.